Hello, I'm Victoria Hatcher and I'm here with Richard Carter, and welcome to another episode of This is Surgery, where we really get behind the scenes of what it means to work in healthcare. Today's guest is Sumeyya Erdem. She is the product manager for digital health at Olympus EMEA, and we're thrilled to have her with us. We're really going to spend some time talking about what it means to work in product management, to think about how you really create stickiness on the front line with some of these technologies that are in the market now. And it's just been a pleasure to have her here. So we hope you enjoy it, and like and subscribe for future episodes. Lovely stuff. Well, Sumeyya, welcome to Proximie in our London office. Tell us, in your own words, what do you do?
First of all, thanks for the invitation. I'm really happy to be here, and it's also first time for me to be in the Proximie office, so I am even more excited, including my excitement for this podcast. I work as a product manager at Olympus, and I'm responsible for digital portfolio across the EMEA. And what this portfolio includes a bit like medical recordings, like content management system, telepresence. I feel that I work in the intersection of digital technologies and surgery. So what I do basically, I support clinicians or healthcare professionals with the digital tools and digital platforms that we innovate or we produce in Olympus during the surgery, but not only during the surgery, before and after. So I try to make sure that they really focus on what truly matters for them. This is their patients.
I love that. Lovely. So is there any parts of the job that you sort of highlight to people whenever you're explaining what you do to them?
Yeah, when you talk about the product management, people usually think about the product launches, features, roadmaps, and of course they are part of my job, right? Like this is also in technical part what we do in the office. But for me, what I really do is like listening. So visiting hospitals, like standing in the corner of the operating room, just listening, basically observing, how the team inside of the operating room is communicating each other with any words. If there are any friction, in the end, you need to get used to the environment itself, make yourself familiar how it works. So the technology, especially in digital technology, you bring this environment can work together in the rhythm of the operating room and the rhythm with the team. So what is most important is like if your product can work together with the team as a part of the whole process. When it comes to the digital technologies, we are not pushing them. The surgeons, they check if this reduces complexity for them, if this helps the decision-making process instead of distracting them. So this is how a product can earn its own place in the healthcare environment.
Yeah, I love that. I love the idea of like the deep listening, and your role is really to be that person who listens, understands the rhythm, and then works out sort of how this all comes together to bring value. Love that.
So you mentioned the role of technology bringing people together. I mean, one of the things that sort of I remember is in the very early days of Proximie's mobile app, we used it so that Nadine, who's the CEO of Proximie and still a practicing surgeon, could supervise a procedure on my own hand. And that really brought it to life for me, what digital technology can do for the OR. Was there a moment for you when you've been watching how people interacted with your products and you thought, yeah, okay, I can see now how this is going to bring people together?
Actually, there was a moment, and it was this moment is related with the product we are having for partnership, Proximie. One of the first installation was happening in Italy. I joined my Italian colleagues, and we planned to visit a hospital. And our plan was like we will go there, just help set up the system and just onboard the team, and if possible, join a live session. The surgeon, like the clinician, offer us they have a quite simple operation that we can join. So we can check how they can work, and we can also guide them, and we will be in the OR. Everything was going well in the beginning, but the procedure, which is expected to be easy, then become complicated. Then you can even understand the shift of energy in the room. The team become quiet, and there's a tension in the room. So my Italian colleagues, he said, like, I know a very well-known surgeon in that area. If you want, I can ask him, because they already had the system Proximie in their hospital. We can connect him, and he can support you during this, operation. Then luckily he was available. Like, they accepted, of course. Then he was available. Then we connected him, and within a second, he was in the room with us, guiding the surgeon, like, for an hour. And then you can see the shift in the room. The energy changed. Then it's more stabilized. Then they were more calmer. Then there's someone who is already experienced and supporting them. This is where I see the real impact. And I saw that my Italian colleague is smiling. He told me, if we wouldn't have this digital tool here, this operation would be quite difficult for me and for the patient itself. In that moment, you see the real impact of what you are doing in a real life. So this was a very special moment, stay with me.
I've got goosebumps. It's a bit humbling, isn't it? Those stories of where you hear in real life settings with real people, real patients, that the product's doing.
And it was not planned at all. We were just, the product was in the right place, in the right moment, and we were there in the right time. Then I see the real impact.
But it sounds really special. That's lovely. Oh, thank you for sharing that.
And I guess when you sort of look longer term, do you see, not just with the relationship with Proximie, but more broadly across all digital products in the OR, are you able to sense when those products are going to stick and when they'll just be left in a corner? What's the sort of things that you see that help to surgeons or the surgical teams go, yeah, I want to use that again and again?
I think the real success comes when your product becomes invisible. There's no cognition referring that platform because he's already using it. It's part of his work. You can sense it if a product will stick or not with the behavioral changes. The surgeon asks for the product not because it is mandated. He sees the value and he wants to use it. Or a nurse already include this product, the preparation phase. So it is already part of their workflow. When I see that, I like this product is invisible. So this is so good. And this kind of behavioral, attitude shows you if your product will be successful in the field, especially the healthcare, the digital healthcare, because in the end, the healthcare is very conservative area, and it's not easy to include any digital solution without proving the value. But when a surgeon or the healthcare professional, when they see the value, they will keep it. And you will see it. It will be their part of workflow.
Totally, we see similar things all the time. It's so right. Just going back to sort of that sticking point and what really drives that stickiness, because you can have the right tech, right, but it can still not gain the traction. And so I wonder, sort of from your experience, when you work with hospitals and they're considering the digital tools, what seems to be the most important to them in terms of those decision-making factors?
Evidence is important. Without any credibility, you cannot even start a conversation, right? But I don't think the evidence alone will be enough to close the gap between interest and implementation. Like, you can increase the interest, you can just get some attention, but when it comes to implementation, this part is different. So I think there are 2 or 3 factors that drive this part, and these are, from my perspective, most important than evidence, which is like workflow alignment. If your product is really aligning the workflow of the team, it's really supporting, it's really reducing complexity, it's really giving them comfort. So this is quite important. The next one, interoperability. So this is your product works very well with existing infrastructure. They cannot change the investment they made it over years in a hospital because you want to implement your product. So you need to make sure that you are building something which is already compatible what the hospitals have or exist there. Last but not least, and from my perspective, the most important part is trust. The companies, it's not they're only buying a digital device. It's a long-term partnership for them as well. So for this long-term partnership, they want to feel confidence that my partner will be there when I need support they will evolve their solution, so they will improve it, and they will provide what I need in the end. So I need to trust them. I think this part is quite important because as an Olympus, we can see that there are some companies, like let's say there are other products, maybe have a better feature than we have it, but they still come to Olympus because for them, the trusted partner is Olympus. Or maybe for Proximie, there are also other, the platforms, they provide the similar digital services, but if they trust you, they will come to you.
Yeah, absolutely spot on with that.
So you mentioned interoperability and the importance of hospitals being able to get value from their existing investments. And I think you recently were in Barcelona in an Olympus experience event showing OlySense and Proximie working together. Can you tell us a little bit more about that?
Yeah, this field visit in Barcelona is also a very nice experience for me. It was also quite important for us. Hospital Del Mar is one of our reference center in Spain. So we want to show how our devices with our digital platform, and as you mentioned, we have a new AI-powered OlySense solution. They work together. This was a quite intensive training program for 2 days, like more than 100 surgeons. They're invited. The nurses, the biomedic, the different stakeholders from the hospital, they were there. And it was a great place for us to show actually what we have, also how they work together. So what we did, basically, we connect the Proximie to our AI-powered solution, OlySense. So we live stream directly to the remote audience. So it was a great moment for them because we're not only showing the device itself, we are enabling a remote collaboration there, like the clinician inside of the operating room. The remote participant, they're observing, they're watching, they're learning, and they're discussing there at the same time. Proximie was opening us another windows, and for them to have this great space that they can learn together, they can share their experiences, and they can also see the new technologies, right? Like without the Proximie, they will not be able to, the only people in the operating room will be able to see that there is a new technology coming on the way. But right now with the Proximie, we are able to show also not only like what's happening, like, or the techniques or in the operating room. Now we are also able to show the new technologies, like how it's going to affect the future of the healthcare.
So you're sort of expanding the reach of that knowledge around OlySense into the big wide world in a way that you wouldn't have been able to do otherwise unless people were there physically, I guess.
And the funniest part, the second day, because this training was 2 days, the second day there was a storm alarm. So usually they host the guest inside of the hospital, but there was an alarm and there was notification that like only leave the house if it is necessary, if it is urgent. Goodness. So the guests from the different cities, they had to stay in the hotel. So they wouldn't even able to come to the hospital. But luckily we had a Proximie there, so we were able to live stream not to the hospital conference room, but the hotel conference room. This was again surprising moment for me, but also how I see the impact of my product in a real life.
Yeah, I love that. These things happen, yeah.
And as well as the kind of interoperability, you mentioned partnership, and partnership's a word that gets thrown around a lot in healthcare, and it can mean everything from 2 logos together to 2 really, really deep working relationships. How do you see partnerships in general? How do you see them working well?
In healthcare, the partnership usually goes beyond the contract or this integration agreement you sign it. Like it's not only merging 2 technologies together or like having one technology into your portfolio. It's also aligning the philosophy of 2 companies. Like when it comes to, for example, the partnership we have between Proximie and Olympus, I think what made very special to this partnership, we had a shared belief. And this belief was the surgical expertise should go beyond the physical wall, should not be limited by geography, right? And what Olympus brings for this partnership is basically the decade of experience they have in the operating room, the imaging system, therapeutic solution. So they brought their experience, and Proximie brought their powerful telecollaboration platform. When they come together, this kind of, the technologies and what with a one shared belief, these are complement each other. They're not overlapping. I want to refer back the previous, the moment that I was sharing with you in Italy. So if a young Italian surgeon can have a remote guidance during a challenging moment, it is not because two companies sign an agreement. It is because their system works together seamlessly.
So a really, really nice example. And from everyone at Proximie, thank you for the partnership that we've got with Olympus, because it is really something special that we have that shared understanding and alignment, not just for now, but also the direction that we're both going in together. So yeah, and thank you for your part that you're playing in that as well. It's our last question, and we ask everybody this question. It's, Sumeyya, what does surgery mean to you?
For me, the surgery is one of the most complex environment in the healthcare. So you need preparation, you need teamwork, you need all the devices set up there, ready. So you don't only need a very well experienced surgeon, you need a whole team. They work together with the collaboration. For me, the surgery is a teamwork. So this is how we need to also approach when it comes to the creating digital health technologies. Our technology should be part of this team. And plus, when they are part of this team, they create an ecosystem that this team works well and in comfort.
Thank you so much, Sumeyya. It's been a brilliant conversation. We really appreciate it. And until our next episode, I've been Victoria.
I've been Richard, and we look forward to seeing you again on This Is Surgery.